In our town hall findings, one of the main concerns that consistently came up, not only in mine, but in every region's town hall, was the concern of mental health amongst our youth. Not only have Americans suffered the physical and economic costs of COVID-19, but the crisis will surely take a mental health toll on our most vulnerable citizens as well. The mental health impacts, like most impacts of COVID-19, will likely disproportionately be affecting Native American communities. And that is because poor mental health and inadequate access to mental health care are already an epidemic in many Indigenous communities, especially for young people. Healing can take its course in Indian country with accessibility, resources, funding, support, and cultural competency. With more accessibility to facilities such as a Center for Behavioral Health with culturally aware mental health professionals, our Native youth can be guided, treated, and healed. Implementation of mental health programs or resources into educational institutions on and off Native reservations could mean a shift in mental health understanding as well as emotional intelligence and healthy coping mechanisms. Cultural competence in mental health care of Native youth is crucial in the healing process. It is critical for mental health professionals to be aware of cultural differences, historical trauma, and also treatment approaches. Healing also cannot be limited to the westernized ideals of treatment for mental health. Positive changes occur with a positive approach. With our children and young adults being educated on what mental health is, what healing is, and being provided support, resources, and accessibility, we are breaking the stigma and shifting the conversation towards healing our intergenerational trauma. By equipping Native youth with the knowledge of mental well-being, we are empowering them to break the many cycles of intergenerational trauma in our communities and families. They will be prepared to graduate high school and pursue higher education. They will end the dependency of alcohol and drugs in our communities. Suicide will no longer be the final question, and they can be successful, happy, and healthy. Healing takes resources. Funding, support, facilities, educational programs, and mental health professionals can make the difference that our Native youth need. Help to make that difference, to give that support. The future of our Native community is in the hands of our youth, and their lives are in your hands. Shanabashat Mado, thank you.
The Unity Peer Guides are here to help. We know that together we can heal our communities. The Healing Indigenous Lives Initiative is supported by a cooperative agreement between Unity Inc. and the U.S. Department of Justice, Office of Juvenile Justice and Delinquency Prevention.